I was so glad to see Senator Stabenow down on the floor a week ago talking about a pretty simple issue, which is the tax increase that is going to occur to 6.4 million Americans if the Supreme Court rules this week, next week, for the plaintiffs in the case of King v. Burwell. And so we wanted to come down to the floor and accentuate this message so that people all across the country know what is at stake here. What is at stake is 6.5 million people losing their health insurance. That maybe gets the headlines, but the way in which people get affordable health insurance under the Affordable Care Act is by tax credits. And so the immediate effect of a reversal of subsidies for federal exchange states is that 6.5 million Americans are going to have their taxes dramatically increased by thousands of dollars if this body refuses to act in the face of a Supreme Court finding for the plaintiffs. And so we want to come down to the floor today just to talk a little bit about what the stakes are here for people's tax bills and how this is going to be a gut punch for millions of American families if the Supreme Court rules the way that we hope they don't. I think it's, first of all, important to say at the outset that most of us that have followed the Affordable Care Act and its legal interpretation think that this is a sham of a case. This is a political attack on the Affordable Care Act masked as a legal case. There's absolutely no question that the Affordable Care Act was built in a way to deliver subsidies to both state exchanges and federal exchanges. I won't go into all of the details as to why that's the clear case, but though we're talking about what might happen if King v. Burwell comes down for the plaintiffs, many of us think that that would be an absolutely ludicrous legal result, one that would be a stunning act of judicial overreach, essentially the political substitution of the court for the legislature. But I want to talk just about a couple case studies here and then turn the floor over to my colleagues. I've come down and talked about people from Connecticut. I talked about Christina, a small business owner from Stratford, or Susie, a two-time breast cancer survivor from North Canaan, Connecticut, or Sean and Emily, two freelancers from Weston. All of these people have gotten tax credits through the Affordable Care Act, and it's allowed them to have a lower tax bill, but also get insurance. Many of them, it was the first time in their life or in recent history that they've been able to afford insurance. But there are stories all over the country that are parallel to the stories that I've been telling on the floor of the Senate over the course of the last year from Connecticut. For instance, there are 832,000 Texans who are receiving an average tax credit of $247 a month. If the Supreme Court strips away these tax credits, those 800,000 people in Texas are going to see a tax increase of around $3,000. People like Aurora, who's a 26-year-old from Houston. She got health insurance coverage through Texas's federal marketplace. She works at a small nonprofit where she helps her LGBT peers find the coverage that they need. She's saving $1,500 a year getting insurance that she would have never been able to afford. She says, quite simply, I wouldn't have been able to afford my policy otherwise. It's really helped me be able to get my well person exam and other preventative screenings that I haven't had in years. She's one of 832,000 people in Texas who are going to have their taxes increased, their insurance stolen away. Now, I'm a big New York Giants fan, and so I get to watch a lot of games in which the Giants are playing in this stadium, which is, as Cowboy fans know it, AT&T Stadium. You could fill AT&T Stadium 10 different times. And this is a huge stadium. People have seen the giant Jumbotron on the roof of this stadium. You could fill AT&T Stadium 10 times with the number of people in Texas alone that could lose their health care and lose their tax cut, $3,000 on average per person a year in Texas, if King v. Burwell is decided in favor of the plaintiffs. But I'll tell you another story of a young woman named Celia. She's a self-employed Pilates instructor in Florida. And since 2005, she hasn't been able to find health care coverage. Since 2005, she has been uninsured. Now, she's been lucky because she didn't get really sick during that time. But she only had a $900 a month plan that she could find. That was the cheapest. With the Affordable Care Act, Celia finally has insurance. Celia is able to finally sign up for a health insurance plan that has meant something to her, because last year she had a minor accident in her home. She had to go to the emergency room, and with her insurance, she received a bill of $57. She says, quote, "I couldn't have even imagined what that would have cost me out of pocket, more than I could have ever afforded." This year, Celia has re-enrolled in another silver plan, and for around $200 a month, she knows that she's going to be covered if she gets sick or if she has another minor accident. In Florida, you think this is a lot of people, 832,000 people. In Florida, there are 1.3 million people who are receiving health care tax credits right now. Now, I root for the University of Connecticut Huskies, and so we don't necessarily get to play in stadiums this big when you're playing out of the American Athletic Conference. But everybody in Florida knows the Swamp, and you could fill the Swamp 15 times over with the 1.3 million people that could lose their health care tax credits. That's more people than attend Gator football games on an annual basis. That's more people than attend Gator football games over a 2-year period of time. 1.3 million people are going to lose their coverage in Florida alone. And so let's call a spade a spade. This is about health care. It's about our belief that for people that are working hard and playing by the rules, that they should have a shot at being healthy. But it's also about keeping people's tax bills low. If we ever contemplated a bill on the floor of the United States Senate that raised 1.3 million people's taxes in Florida by an average of $3,500, my friends from the Republican side of the aisle, our friends would be screaming bloody murder that this was a unjustifiable, unconscionable, unworkable tax increase on the American people. But there's largely silence or temporary fixes and patches that are proposed. And so I'm glad to join my colleagues here today to talk about what this means. Now, I'm from Connecticut, and we have a state exchange. And so the conventional wisdom is that those of us who have state exchanges are going to be protected because we'll continue to get subsidies. But this is going to be a death spiral nationally. We have no idea how this will actually play out. When you have all of these subsidies ripped away, with the insurance reforms still baked in, even in states like Connecticut, where you have a state exchange, we're not immune. Nobody is immune. The primary victims here are going to be the people in states like Florida and Texas, as I mentioned. But this is going to be a national catastrophe. We hope we don't ever have to have a conversation on the floor of the Senate as to how to fix this, but we better be clear ahead of time as to what the implications are. So with that, Mr. President, I'll be glad to yield the floor, and I know my colleague will seek recognition.